Hello, my name is Catherine Liao. Today is Saturday, May 16th, 2020. On behalf of Asian American Civic Scholars, I am interviewing Dr. Jing Wang, who is a prominent infectious disease physician in our St. Louis area, about her efforts against COVID-19. Thank you, Dr. Wang, for taking time out of your day to be here.
You're welcome.
Okay. So COVID-19 has drastically changed the world and our lives in many ways, especially for Asian Americans and healthcare workers. Being a Chinese infectious disease physician, what has your COVID-19 experience been like so far?
So, United States already goes through COVID pandemic outbreak for at least 2 months. I still remember we really start to really engage. My first day real devoted onto it is around mid-March. After that, it's a long fight and it's real tough. You know, I think as a frontline doctors, it's one of the toughest time in our career, mainly because the virus threatening and COVID is a very contagious disease. And you probably watch TV and how bad it is going on all through the world, not only in China, but also in Europe. So not only like thousand people are dying, but it's because it's so contagious. And so with the disease going on, 20% of the population actually got it are the healthcare workers. So when you are taking care of the patient, you are not only use your knowledge, skills. Most scary and most stress part is our self is threatening, and especially unfortunately we do not have enough PPE, and even now PPE condition are getting better. It's still very limited. So in Italy, there's 20% of the healthcare worker infected, and this is not only infect yourself. It matters is when you see a colleague collapse and get onto the ventilator, and some of them even have to go to ECMO, and some of them die at very young age, and your heart is real aching, and it's a direct threatening to yourself and also your family. It's because just like now, I'm sitting here talking to you, and when I live completely separately from my family. I haven't seen my family in the last 2 weeks because I have to work in the COVID ward. So it's kind of very, very tough for us when you have to move on, have to take care of patients, but yourself are severely threatened. And also, currently our patient load in the hospital is coming down a little bit, but at the beginning, when the outbreak comes, so many patients coming in have the same similar symptoms, could not breathe, they required a similar care, like they need a ventilator, and they immediately, and many of them, especially people who have very poor immune system, very serious comorbidities, they are dying. And as a physician, you do not have very effective treatment, even up to now, when remdesivir, this medication just shows some effective way, but the most people who come to ICU who have severe disease, their mortality, that means chance of death in ICU is 50 to 80%. So when you take care of patients, but you cannot save them, many of them have to go back home or dying in front of you. This is it's, at least to me, it's very, very bad experience. Because, you know, as a physician, the most important thing for you to do is save life. But when you see the life and you struggle with them together, try your best, but still have the half of the chance patient will die in ICU, it's a deep sorrow in your heart. Like you feel yourself cannot, sometimes you blame on yourself, why I cannot save such a nice man. And this is a real tough time for us, no matter for the, you know, ourselves be threatened, or even during your career, you cannot save people as you wish, because we do not have a good vaccine, we do not have good medication. Even with ventilator, those supportive care, still you cannot save half of the life those people get into ICU. So those are a real tough time. And I don't know whether you have chance to see some Facebook videos. About 1 month ago, I think Chicago ER doc posted some video how they face COVID in ER. And before they saw the COVID is just affecting the old people, but even a lot of young people, when they arrive, they just die there. They cannot breathe and could not even, you have like 1 hour or 2, you could not get them back. So when you see so many things going on, it's sometimes it's such a tough things. Like it's just like when you want to do something, you want to commit to what you originally become a doctor, is want to save people and do great things, right? But you could not, and plus yourself and your family are so severely threatened. So I have already been exposed many times to cases whose patient who later found out COVID, then be called many times. And each time is, it's very uncomfortable feeling, even so many times. Like some of my colleagues, when they go to the clinic and suddenly in the morning they found out they have fever, and then later the second day they found out they're COVID positive, and just 1 day ago you're with them together in office. And so that feeling is real terrible. And when you see your colleague who are very sick, one of my previous colleagues, he was really on the ventilator for more than 10 days. That's not fun at all. And so plus the long time working, and you know, when you have wear very, very thick N95 mask and have to coat yourself and up and work long hours, and even have no time to go to bathroom, have no time to drink and eat.